Welcome to Target USMLE. Today we will be seeing how we go about taking history in a joint case. Ready? First of all, just sit back and think. What are the possible symptoms a patient with a joint problem is going to approach you for? First and foremost, mostly joint pain. It could be inability or restriction to move the joint. They can come to you because the joint is red. If there's swelling in the joint, or even bone, like in a bone tumor. Some generalized symptom like rash, if they have stiffness of the joint, or clicking sound when they walk or move the joint. The most common symptom, as we all know, is joint pain. So let's see what questions we're going to ask regarding the joint pain. Of course, after you have asked, do you have pain in any of your joints? Or the patient herself or himself says, I have pain in my knee joint. For example, it might be a 66-year-old female comes to the clinic with history of pain in her right knee joint. Vitals are normal. Then we're pretty much saying, how do we go about that case? Alright? So you ask for OPDS CF. Okay? OPD stands for onset, progression, duration, and setting. And CF stands for if it's constant or intermittent. And F stands for frequency. So how did the pain start? Was it sudden or was it gradual? Is it getting worse or is it getting better or has it been just the same since it started? Duration. How long have you had this pain? S is for setting. Setting is very important. For example, the pain might have started when the patient tripped and fell on her knee joint perhaps. Or in another scenario, it could have been a clerk who was just trying to reach for a file in the lower cabinet and then just then her back started paining. So this gives you a clue sort of, probably she has any disc herniation or prolapse because it's an acute pain which started when she bent over and tried to pull a file cabinet. And then you have C and F. So you want to ask, is the pain constant or is it intermittent? Now if it is constant, then there is no point asking F, which is frequency. So if it's intermittent, you ask how frequent do you get it in a day? Then you guys know the famous LICORA. So location. Can you point out with one finger where exactly is your pain? So the patient might just point out to the joint line or maybe to any bony point. Make a note of that, okay? And then I is for intensity. On a scale of 1 to 10, 1 being the least and 10 being the worst, how would you rate this pain? Q is for quality. Can you describe the pain for me? Is it sharp, dull, or throbbing? O, you've already asked onset, so you can skip that here. And then R is for radiation. Does the pain travel anywhere or does it move anywhere else? Then the AAAs are aggravating, alleviating factors and associated symptoms. So does anything make the pain better? For example, the patient might say maybe giving hot water fomentation makes it better. And what makes it worse? The patient might say, I'm fine as long as I'm sitting, but when I start walking, then it starts to hurt, doctor. Okay? And think of the other associated symptoms in a joint case, which is the list that we just went through. Is there any stiffness, any warmth, if there's any redness? What if there are multiple joint pain? Multiple joints, when they're involved, please ask, what's the order of involvement? Now pay attention to the clues that you get in history. For example, if it's rheumatoid arthritis, the most common joint that's involved is the metacarpophalangeal joint. If it's osteoarthritis, it's mostly the knee, especially in an elder woman, postmenopausal. If it's a younger person, probably it's because he or she is overweight. Okay? Gout, you guys know, it usually attacks the big toe and usually it's acute in onset. Now let's go on to what are the other topics under which we are going to discuss history today. So first of all, let's look at some local symptoms regarding which we'll ask some questions. Then we'll think of some general symptoms to ask the patient in a joint problem. And then we'll attack all the differential diagnoses we have to come up with by the end of this encounter, right? So let's start with the local symptoms. How did you injure yourself? Make a point to note if it is because of a fall. Perhaps the patient had osteoarthritis for 5 years, but it's probably just her recent fall after tripping on a stone in the garden just brought her attention to the joint problem. Okay? Any history of trauma, accident, sometimes people practicing for a marathon, vigorous exercise can also strain a joint, can tear a ligament. And then substance abuse, IV drug abusers for septic arthritis. Factitious, always remember they could just be acting. And especially for the Step 2 CS, of course in Step 2 CS they are acting, aren't they? More importantly, in Step 2, you have to keep an eye watching for abusive relationships. So if it's an elder woman who's kind of trying to evade questions, not looking directly into your eye, cover up things, you just tell her, you know, Miss Smith, I really am very concerned about your safety at home. Are you safe at home? Do you feel comfortable? If there's anything you want to tell me, whatever you tell me will be kept confidential. So all this comes into the communication and interpersonal skills to win the patient's confidence, okay, and build a rapport. All right, is there any redness, okay, any swelling, any warmth, any stiffness, and any distal muscle weakness or proximal muscle weakness because of a joint problem? So just think of all the local things that can happen in the joint. You can even ask, are there any color changes in your skin, you know, distal to the joint, probably because of a vascular compression, a bone tumor, or a joint problem. Let's go on now to the general symptoms. You know, fever, any rash, any fatigue, especially rheumatoid arthritis, is not only a particular disease of the joint, it affects other systems as well. So it can be a really debilitating disorder. So ask for weight loss, loss of appetite, and also ask importantly, is there pain in any other joint? Also keep in mind of bleeding disorders. It could be hemarthrosis, so try to find out if there's any history of bleeding disorder. Hypothyroidism can also cause joint effusion, so ask patient for any history of thyroid problems. Like hypothyroidism, you ask them if they've gained weight recently, is their skin dry, is there loss of hair, do you feel cold when others don't, things like that. Okay, so we've finished local symptoms for the joint, we've finished kind of general systemic symptoms, and let's move on to specific questions to rule out our differential diagnosis. Okay, for rheumatoid arthritis, of course, the stiffness is a very important symptom, especially in the mornings. Okay, don't ask them, do you feel stiff in the morning? Now that's a leading question. You want to ask them, which part of the day do you feel your stiffness is worse? If when they say, oh doctor, as soon as I get up my joints are so stiff, does it get better as the day unfolds or as the day goes by? So that is a characteristic history for arthritis, especially of rheumatoid origin. Any deformity of the joint. Ask for any nodules under the skin. Osteoarthritis, what can you ask to confirm if it's osteoarthritis? Any clicking in the joint, especially on movement or walking. Okay, and in physical examination, of course, you will look for any crepitus in the knee joint. Now, any restriction of movement, okay, because of the osteophytes. Remember, it's a degenerative disease, especially occurring in older population. But like I said, even younger individuals get it nowadays because of overweight becoming an epidemic. Now, septic arthritis, you want to ask history of any sexual transmitted disease, any vaginal discharge, any foul-smelling odor, any fever, of course, with chills, and any history of miscarriages and abortions in the past. Okay, so those are questions if you're thinking about septic arthritis. Now let's see what happens if it's arthritis due to SLE or systemic lupus erythematosus. Any rash on your face? Okay, so they get a characteristic, a butterfly like rash called the malar rash, isn't it? Any photosensitivity? Are you sensitive to bright light? How would you ask tick associated arthritis? Have you recently gone hiking? Any history of tick bite? Any rash? Next, let's move on to Rheumatoid syndrome. So what do we ask in Rheumatoid syndrome? Any genital ulceration? Any burning micturition? Any history of red eye, conjunctivitis, and any oral ulcers. Okay? You know it's a triad of what? Triad of arthritis, urethritis, and conjunctivitis. Alright, let's summarize now what we have talked so far. So in any joint case, how do we go about history taking? We want to ask about the most predominant symptom, which we hope in most cases will be joint pain. We're going to ask OPD-FSC. We're going to ask about Licora. And then we're going to ask about all other symptoms of the joint, which are local symptoms, general symptoms, and then we want to rule out rheumatoid arthritis, osteoarthritis, septic arthritis, SLE. So there are two S's, so it's like ROS if you want a mnemonic for RA, OA, septic arthritis, SLE, and then you have to remember the other two. Tick bite, Rheumatoid disease. Okay? Oh, you could sign up for a free trial with me so I can give you feedback regarding how well prepared you are for the Step 2 CS. I would also give you some free tips. If you found this video helpful, you will also get some more tips and tricks how to go about the Step 2 CS. You would see on the website we do have a course for people who are taking Step 2 CS. And so if you'd like to try the free trial and see if you like it, if it's going to be of use to you, then you can always sign up for our course. But to get a free trial, I'm there on Skype. My ID is MJJune1. And if you want to talk to me over phone, I'm in India right now. It's 919003271258. You can always contact us via the website by clicking on the contact tab. Now, whichever way you use to register and choose to contact us, remember we at Target USMLE are here to help you shine at your very best. This is Dr. Mary June, Director of Target USMLE. So good luck and take care. Bye-bye.